Assalamu alaikum and welcome back to another episode of What's Up Doc. I'm your host, Dr. Aalia Al-Barwani, and I'm a board certified physician. My show, What's Up Doc, is a production of Muslim Network TV, the only Muslim focused network broadcasting in North America. You can watch our shows on our website at muslimnetwork.tv and on our YouTube page at youtube.com/Muslim Network TV. You can also find our shows on Roku TV, Fire TV, Apple TV, and Galaxy 19. Today's show is about a condition that by some sources is a single leading cause of disability worldwide. This condition is back pain. Some studies estimate that up to 80% of the population will experience back pain at some time in their lives. That's a big number. Joining us in that discussion is Dr. Toya Burton. Dr. Burton is a chiropractor and chief operations officer at Watley Health Services Incorporated. She's an adjunct professor at the University of Alabama, and she received her degrees from Alabama A&M University in zoology, doctorate in chiropractic Life University, and master's in public health from the University of Alabama at Birmingham. Dr. Burton is one of a few chiropractors in a community health center in the country. She is a health services researcher who worked with musculoskeletal pain for over a decade and has published an article on pain and cognitive behavior. She's a strong advocate in health and pain education and health disparities. She volunteers with the Susan G. Komen and American Cancer Society and is a past recipient of the Excellence Award for Advocacy from the American Cancer Society. Dr. Burton has also served on various boards and is a member of Alpha Kappa Alpha Sorority Incorporated. Welcome, Dr. Burton. It's such a pleasure to have you here with us.
Thank you, Dr. Al-Barwani. A pleasure to be with you.
Yes, you definitely have spent quite a lot of time in doing the hard work that comes with your title, and we really appreciate that.
Oh, thank you very much.
Of course. So in today's episode, like I said, we're going to be talking about back pain. As a primary care provider, I see that quite a bit. And as a chiropractor, I can only imagine you see that even more.
That's all I see is pain.
Absolutely. They're not coming to you unless they're in pain. And
Right.
It's probably in their back most of the time.
That's
so before we
correct.
jump into before we jump into talking about back pain and all of the nitty-gritty, let's take a step back and talk about what you do as a chiropractor. What is a chiropractor and what's involved in chiropractic care?
So a chiropractor is a doctor who removes what we call subluxations in someone's spine or misalignments. And a subluxation is a misalignment where improper motion can happen. Sometimes that misalignment causes pain and also impingement upon nerves. And so an adjustment where we put a small pressure into the joint in a proper direction helps to realign the spine and release pressure off the nerves and the muscles to try to restore proper alignment to your body.
Excellent. And so you kind of focused on subluxations of the spine and adjustments that you do for misalignments in the spine. But we both know that there's more to being a chiropractor than just dealing with back pain and addressing issues in the back. So briefly, if you can just share with us some other conditions that as a chiropractor you treat, just again to inform our audience who may not know what chiropractors do and have this very narrow view of what you do on a day-to-day basis. Let's expand their horizons and share with them what actually you're able to treat.
Oh, well, as a chiropractor,
it's a lot, I know.
That's a good question, Dr. Al-Barwani. So as a chiropractor over the past, 16 years, I've treated ages from 6 months old to my oldest patient is probably 92. It varies between back pain, neck pain, people who have disc problems in their neck or in their back, people who may have sciatica, that's pain that shoots down the leg or both legs, people who have nerve impingements in their neck. I have treated kids who've had ear infections. I've treated pregnant women. As women are pregnant, and their pelvis starts to expand. It can cause more stress on the lower part of their back and create some difficulty walking. So it varies. Also, for myself, if I get car sick and nauseated. So if I get an adjustment prior to me riding in a car for a long period of time, that helps me out a lot. So I don't have to take over-the-counter medications to kind of almost sedate myself before I ride in the car. So there's a lot of different things that chiropractors can help with.
That's amazing. I particularly am interested in the adjustments for car sickness because I get that. I mean, watching people play video games make me motion sick, so it's pretty bad. It sounds like I need an adjustment.
Well, we don't worry about you going on a roller coaster.
Yeah, exactly. I think I'll need one before and after.
Right. So you and I would just wave at everybody at the top.
Exactly. All right. So back to back pain then. What are some common reasons that you see for back pain? I know that in my practice, they're coming in really sometimes, a lot of the times related to work injury, but as a chiropractor, you probably see that as well. But in general, tell me some other reasons that or causes for back pain in someone.
Well, some causes may be herniated disc or slightly arthritis in the lower part of the back, in the joints.
Sorry to interrupt, Dr. Burton, so early in your answer, but can you break down what a herniated disc is?
Okay. Oh, wow. Okay. So herniated disc, and I'm trying to think of how I can make it really simple. So the way I explain it to my patients is, and let me say this, the only way you can really see what a disc is doing is by having an MRI. X-ray can show you if you have misalignment of the bones, like severe misalignment of the bones. It could show you have disease in bones by X-ray. It could show you if you have arthritis. It could also show the disc space in between each bone. But the other thing that a MRI can show that an X-ray cannot simply show is that you may have a disc that's out of place. And so my easiest way to explain it to people is that the disc is like peanut butter and jelly in between two pieces of bread. Your two pieces of bread is the bone, and the peanut butter and jelly between the two pieces of bread is your disc. And so if someone came along and put their hand on top of the piece of bread and pushed it down, and you start seeing some, let's say, peanut butter or jelly oozing out, that's probably the easiest way to explain what a disc dislocation or herniation is. It's where a part of your disc is pushing out, and sometimes that disc may push on your nerves, or that disc may push on your spinal cord and create pain.
That is the most creative way I've heard that described. I love it, and I'm going to take that.
You're going to take it. You're going to use it tomorrow. Okay.
I love it. Okay. All right. So now that I have a visual for bulging discs, you said that's one of the common causes for back pain. Please continue.
Okay. So besides a bulging disc, you can have a muscle strain or sprain, where the muscles are kind of tugging from one side to the other. That can create pain. You can have a muscle spasm that can create back pain. You can have arthritis within your joints. You have joints that ride on top of each other. They're called facets. And they look like, I would say this. If you take my fingernails and put them on top of each other, these are your facets. Well, sometimes they get a little gritty in between the facets, and so they're not as smooth anymore. And that creates pain. That friction creates pain. And sometimes your facets, instead of being on top of each other, one can roll off to one side, and that creates some discomfort. So whereas your mobility to go forward would be all the way, instead of going all the way, you would just be able to go this far. And so that creates back pain as well, and decrease people's quality of life and their inability to bend forward and maybe tie your shoes or pick up something off the floor. And the same thing can happen in your neck as well. So those are just some examples of causes of back pain.
Very interesting. So some of it sounds like is a result of the way that we move, and some of it may be something that comes with age, possibly, or lack of activity. Would you say?
Yep. Unfortunately, a lot of us, majority of us, will get what I call a boyfriend, a girlfriend that you may not want. And that's author, arthritis. So I tell my patients, if it's a female, you probably got author, and for males, you may have arthritis. And some females may have arthritis, and some males may have author. So it all depends. Um, but this may be a companion or a partner, life partner that you may not want, but it comes along with age and it decreases our mobility. And it could be our jobs. If you have a strenuous job that makes you lift and pull things for a long period of time, I've had patients that work in plants, and from young age, young 20s until like 40s, and they start to have a lot of back pain. It could be the way you sleep. It could be a hard cough or sneeze can cause pain in the middle of your back. It can be standing for long periods of time. It could be the pillow that you're sleeping on can make you have neck pain. Stress makes you have neck pain as well, in turn gives you a headache. It could be a lot of things. A fall definitely can make you have pain as well. So the
Absolutely.
musculoskeletal system is very important for our daily lives.
Exactly. And I love that you gave us such a big list like that. Something else that I noticed that people will come in complaining of back pain, but it's not actually back pain, is any kidney stones or kidney issues as well. They'll complain of some back pain. A different topic altogether, but just something to be aware of as far as back pain.
Exactly.
So when you talk about the health of the spine, and you did a great job of just describing the different parts of the back and the spine that allow us to be able to move, what are some things, I want to start with by talking about prevention and keeping the spine healthy. So what are some things that an individual can do? Because as you said, arthritis can come with age, but I've seen 30-year-olds. It's really how hard you're wearing down your joints. And like you said, if someone is doing heavy manual work and then they have obesity, for example, all of that adds and to basically wear away at the joints. And so they're going to have symptoms earlier in life. And so what are some things that we can do at a young age and even maybe at an older age to prevent progression of back pain related to arthritis?
Well, when you get an x-ray, the radiologist reads your x-ray and they may grade your extent of arthritis, your stage of arthritis. They usually start as minimal, mild, moderate, or severe. And so all of us are going to more likely be in one of those stages in some part of our life. But like you said, when you're younger, you can definitely get arthritis. So to keep the body moving is very key, period. If we pay attention to kids when they're babies, and we pay attention to cats and dogs, if you have a pet, you will notice when they wake up, the first thing they do is stretch. Before they get out the door, they're stretching. It may take a little bit longer, and you're like, come on, I know I do my dog, but that's just natural. We're born to stretch. And as we get older, we stop doing that because we get in such a hurry to try to do our things, get started for the morning. But stretching is key. So I tell my patients, if you try to stretch in the morning before you get out of bed, kind of bring your knees to your chest, hold them for a couple seconds, release it again, hold it for another couple seconds, at least repeat that about 3 times in the morning. That helps to increase your mobility in your lower part of your back. Also, yoga is a great thing to do. Yoga, meditation, a lot of people do, especially try to release some of the tension off your shoulders. So walking is always a great thing. Trying to maintain a healthy weight is a great thing to do to decrease the stress on your knees, because no pun intended, but our skeletons are not big boned skeletons. I know a lot of people say, well, I'm big boned. Well, I don't think skeletons look big boned. Like all skeletons are the same. It just depends on the pattern that we put around our skeleton. So just kind of being cognitive, just being aware of, make sure that we're in a healthy weight. Walking helps. If you see that the impact of running is too much on your joints, just try walking or get a knee support if you feel like you get a knee support, or reach out to your doctor to see if they can give you some help if you have, bad knees or something that prevents you from walking. Now, some people can't walk, and that's fine. There are always chair exercises that you can do.
Mhm.
You can just sit in your chair and just move your arms up and down. You can move your feet up and down. There are little bicycles that you can buy that's like a fourth of a bike. That's just pedals only, that you can just sit there in front and you can just pedal along while you're watching TV. That's a way to get some exercise in and mobility without, putting a lot of stress on your joints.
I love that. Those are some great, great examples of things that we can do. Everyone has access to really just even the stretching, like you said, and the yoga. I've been trying to consciously incorporate more yoga just because I've noticed, like, just bending down to pick up a pencil, I've tight hamstrings. And I'm just like,
Mm,
this is crazy, and I'm pretty active, but I don't think I spend enough time stretching. And one of
mhm.
my favorite yoga poses that really help when I'm having a bad back day is the cat cow pose. Are you familiar
Mhm.
with that? I don't know if you like that or if you recommend that, but that's something that I like to do, and I feel immediately better afterwards.
Yeah, everyone has their own, stretching that they like to do. Some people like to do the downward dog better. Trying to do a mountain pose, that's kind of hard. You gotta you gotta have some good balance. So
You do.
just trying to get a little bit of something that's better than nothing.
Absolutely. So we're going to have to take a quick break here. And then when we come back, we're going to keep talking about different causes for back pain. You're watching What's Up Doc on Muslim Network TV, and we'll be back after this brief message.
A free online chat can give you the personalized tips you need to start boosting your retirement savings today.
Our fellow Americans.
Right now, the COVID-19 vaccines are available to millions of Americans.
And soon, they will be available to everyone.
The science is clear. These vaccines will protect you and those you love from this dangerous and deadly disease.
They could save your life.
So we urge you to get vaccinated when it's available to you.
That's the first step to ending the pandemic and moving our country forward. It's up to you.
Dad, they took over my bedroom. Come on, come on. Okay, Dad. 1, 2, 3. Dad! You saved me. Dad?
Are you okay?
I'm fine, dear.
Your hero needs you now, and AARP is here to help. Find the care guides you need at aarp.org/caregiving.
We are Justice for All. Headquartered in the heart of downtown Chicago, Justice for All is a global humanitarian initiative dedicated to raising awareness for human rights concerns impacting vulnerable minority groups. Our diverse team of staff and volunteers, led by Imam Malik Mujahid, work tirelessly to help Justice for All achieve their goals. We promote policies that protect religious freedom, address the root causes of mass displacement, and recognize the plight of refugees and forced migrants. Together, we can continue to stand up for justice. Justice for all.
Find out how to use an awkward silence to help a friend with their mental health at seizetheawkward.org.
Assalamu alaikum and welcome back to What's Up, Doc. Today we are talking about back pain, and joining us in that discussion is Dr. Toya Burton. All right, Dr. Burton. So before the break, we were talking about some common causes for back pain and some things that we can do to help prevent or to keep our spine healthy. Another thing that I notice about a lot of my patients is, and myself sometimes, is our posture. And I know that our posture can play a big part in our back, in the health of our back, and the health of our spine. So let's talk a little bit about what good posture looks like. What are some corrective things that we can do to help keep that, and how important that is really for the health of our back?
Well, posture is oh my gosh, it's hugely important for us. I try my best to try to be mindful of my posture as I'm sitting here. And I purposely put my jacket on this way because you can see a shift in my shoulders. And so over time, that will make my middle part of my back feel uncomfortable. But if I straighten myself up and watch my posture, then the lower part of my back won't feel so strained. Our body naturally has a curve or several curves in different parts of our spine. Our neck has a backwards U-shaped curve where it's curved here, and this is your face here. And so you should have a curve here in your neck. But over time, if we keep holding our head down, the curve starts to straighten up or even try to reverse itself. And so the thing is, if you try to keep your ears over your shoulders, that helps to keep the curve in your neck nice and rounded out in the back part, and your face is here. That way the nerves that come out the sides of your neck are not so much impinged. But if you turn around and straighten out your neck, it's kind of hard to get that curve back in your neck. And so since this one has
when
a
we're
curve,
staring down at our phones all the time.
yes, phones, reading, whatever it may be. So I try to bring my phone up this way instead of having it down, because I don't want to, change the curve in my neck. Also, if having a pillow that has a little bit of a hump in the front of the pillow, that helps a lot when you sleep. So therefore, you're not on a flat pillow. Some people try to have 2, 3, 4 pillows, and that elevates your head greatly more than the rest of your body. So you don't want to elevate your head really high. You just want to have a good balance between your neck and the lower part or the upper part of your shoulder blade, or upper part of your shoulders. And also for the lower part of the back as well, that's usually I would say probably 75% of people's back pain comes from the lower part of their back. The bottom 2 discs are usually people's first problem. And so the stretching part will definitely help with that. And also watching the way you lift, to lift with your knees, not bending over and lifting something up will help as well to prolong your spine.
Excellent advice. I like all of it, especially the sleeping part, because you're right. A lot of people like to sleep on multiple pillows, and they don't realize when they wake up with pain that it may be how they're positioning at night. So that's a really good point. Another thing that one of my mentors in residency taught me was to always kind of hold my tummy in, like kind of hold my core in, and that helps kind of with your lower back and the muscles there. Do you agree with that? Okay.
Oh yeah, your core is important. It holds not only your back but also the rest of you. And you don't want to slouch over so much, because in your core you have a lot of organs that are very important to us. Not only digestion and your pancreas and your intestines and all of those things. And so they need to breathe too. Your diaphragm, they all need to breathe. So
yeah,
don't put so much stress on them. They have enough to do as it is.
Exactly. So probably doing core exercises as well is a good way to, if you're having some back pain, to help with that, basically, to help kind of get some relief and to also strengthen to prevent possible injury in the future and things like that. Just like when you mentioned proper lifting, we want to have good form to prevent injury as well.
Yes, yes, because as we get older, especially women, we start to gain that belly fat, and men do too. It doesn't go away. So we, it's always a challenge for some people, myself included. And so, as much as you can to try to minimize that amount. And, when we're stressed, we release cortisol, and that brings about some more extra belly fat. And so we want to do our best that we can to try to minimize that and improve your posture.
Exactly. Now, when we talked about the different things you do as a chiropractor for back pain, and I want to focus on, we've talked about the preventative stuff, and then now kind of addressing or treating it from a non-medicinal point of view, right? So non-medication rather. And so when we talk about, you mentioned subluxations and adjustments, and you told us what adjustments are. So let's talk a little bit more about that, because when we think about chiropractors, a lot of people think about the popping and the swift movements and the quick relief. And for some people, it's welcome, especially if they have experience. And for other people, it's a little bit challenging and a little bit frightening because they're hearing all this popping noises and they've been told that popping is bad and that maybe there's a chance that they could break your neck if they do it the wrong way and things like that. So let's share with our audience a little bit more about adjustments and how you go about them and why they're important and how safe are they. I think it'll really help to reassure a lot of people.
Well, first off, that's a very good question. And I know it's a big concern for a lot of people if they've never been to a chiropractor before. As chiropractors, we go to school for 4 years undergrad, and then we also have to have 4 years in chiropractic school with a lot of internship hours to learn how to do an adjustment. And there are at least over 50 different ways to adjust the spine. And you definitely want someone to adjust you who is qualified. There in chiropractic school, and as chiropractors, we're taught how to analyze the spine with x-ray or also with our hands to determine, and with posture to determine if someone is out of alignment or have a misalignment. One way is a chiropractor may take your feet and see if your feet are out of alignment, or let's say not the same length. Another way is to take your hands and see if your hands are not the same length when they're brought stretched out in front of you or stretched out above your head. So there are different ways that a chiropractor can analyze the body to see if the body is out of alignment, and also they can go through your spine or have you to do certain motions to determine where's the subluxation or where's the misalignment in the spine. So they can either use their hands, they can use a table that drops underneath them. They can use an instrument to adjust the spine. They can use a table that does not drop and just put you in different body motions to remove the subluxation or remove the misalignment. Once they do that, sometimes you may hear a popping noise and sometimes you don't. That popping noise is just gas being released between your joints. You have gas in between all your joints. Like before I answered this question, Dr. Al-Barwani, you were popping your knuckles. And that's just release of gas in between your joints. You have gas in between your joints of your knees, your ankles, everywhere we have gas within our bodies. If you ever had an x-ray done, if you look at your x-ray next time, if your doctor is showing you an x-ray, look and you might see little blurbs of black spots. That's kind of clear black spots. That's gas. And so that's okay. It's not going to hurt your joints. But you want to make sure that you see someone who knows what they're doing, who's been trained properly to do an adjustment. And it's not uncommon after you get an adjustment that you may be sore afterwards. And sometimes some people feel really good. Sometimes some people are sore afterwards. But keep in mind that you are moving muscles that haven't been moved in a while. So those muscles have been put into a different place, and they got the muscles, just like your body has memory. and your body is like, oh my gosh, what happened? It got moved. And so it has to adjust to the movement. And so that's why you may be a little sore afterwards, and that's not uncommon. And I would say just, keep with the regimen that your chiropractor doctor has given you in order to try to help improve whatever situation you're going through.
I really appreciate you going through that in quite a lot of detail, because I agree with you. As someone who you've worked on me, and I've been to other chiropractors as well, understanding what you just explained really helped me to feel more comfortable getting adjustments done. And really, as you said, the relief is almost immediate. And luckily, I don't have any serious issues, just like you said, getting out of alignment because of daily activity, really, more than anything. So before we go into break, I do want to go over some other modalities that you may use as a chiropractor, because I know that I've had other things applied, not just adjustments. So if you can briefly share with us other things that you have in your toolbox to help with back pain. If someone says, I really don't want you to do an adjustment, I mean, one would argue, why they're in your office, but are there other things that you can do for them besides an adjustment?
Well, as chiropractors, we go to school and we learn about physiotherapy. And so they can use ice packs or heat packs on you. It depends on what state you're in too, as well, or what that chiropractor is licensed to do. But all chiropractors are licensed to do adjustments. All are pretty much licensed to do, they can do heat packs, ice packs, electrostimulation, heated ultrasound. Some people do something called an SOT block. Some people do dry needling, which is almost like acupuncture. Some people also use cupping as well. So there are different avenues that chiropractors can use to try to help people feel better. Ice baths as well as one of those.
That's good to know. So for someone who may want to ease into getting an adjustment done, there are other options, is what I'm hearing.
Oh, yes. There are other options. You have to, sometimes if someone's in pain for such a long time, even talking to them and just a little bit of counseling can help, because they may be so tense, or whatever they're going through in their life may be creating their pain. So it may be like a psychosocial type situation where, they may have a situational depression that creates the pain. And so they may need to talk to a counselor, or sometimes I've ended up being the counselor sometimes, and just listening and hearing your patients out before you get that adjustment with them, because they may be so tense, they're just not able to relax. And sometimes just talking helps. Some talk therapy helps as well.
I love that. Thank you for adding that. I do agree with you. And something else I wanted to add is that sometimes people expect relief from the first visit, and sometimes that happens, but sometimes it doesn't. And sometimes you have to come in for multiple sessions, because, as you said, the pain that they've had may be chronic. They've had it for a long time, and it's going to take a little bit of time to get that pain relieved or gone completely. And so don't expect them to be miracle workers, is I guess what I'm trying to say.
This is true. It didn't come overnight. It's not going to go away overnight.
Exactly. All right. So I think this is a good spot for us to take a quick break here. And when we come back, we'll keep talking about this and some other ways to help with back pain. You're watching What's Up Doc on Muslim Network TV, and we'll be back in a few minutes.
A free online chat can give you the personalized tips you need to start boosting your retirement savings today.
Our fellow Americans.
Right now, the COVID-19 vaccines are available to millions of Americans.
And soon, they will be available to everyone.
The science is clear. These vaccines will protect you and those you love from this dangerous and deadly disease.
They could save your life.
So we urge you to get vaccinated when it's available to you.
That's the first step to ending the pandemic and moving our country forward. It's up to you.
They took over my bedroom. Come on, come on. Okay, Dad. 1, 2, 3. Dad! You saved me. Dad?
Are you okay?
I'm fine, dear.
Your hero needs you now, and AARP is here to help. Find the care guides you need at aarp.org/caregiving.
We are Justice for All. Headquartered in the heart of downtown Chicago, Justice for All is a global humanitarian initiative dedicated to raising awareness for human rights concerns impacting vulnerable minority groups. Our diverse team of staff and volunteers, led by Imam Malik Mujahid, work tirelessly to help Justice for All achieve their goals. We promote policies that protect religious freedom, address the root causes of mass displacement, and recognize the plight of refugees and forced migrants. Together, we can continue to stand up for justice. Justice for all.
If I could be you, and you could be me for just 1 hour. If we could find a way to get inside each other's minds. If you could see you through my eyes instead of your ego, I believe you'd be surprised to see that you've been blind. Walk a mile in my shoes. Walk a mile in my shoes. Yeah, before you abuse, criticize and accuse. Walk a mile in my shoes. Walk a mile in my shoes. Well, before you abuse, criticize and accuse. Walk a mile in my shoes.
Find out how to use an awkward silence to help a friend with their mental health at seizetheawkward.org.
Assalamu alaikum and welcome back to What's Up Doc. I'm your host, Dr. Aalia Al-Barwani, and joining us today is Dr. Toya Burton, and we are talking about all things back pain. So, Dr. Burton, thank you so much for everything that you've shared so far. We've kind of gone over a lot. We've talked about prevention, we've talked about treatment options and things that you can do to help reduce maybe symptoms even, and then we've talked about things that you as a chiropractor do as far as manipulation of the spine and adjustments. So now that we've kind of gone over all the non-medication portion of this, I know that you do not regularly prescribe, but at times may have to. So what are some of your top medications that you feel might be beneficial to start for back pain?
Well, let me start off saying that chiropractors, as chiropractors, we're not licensed to prescribe medication. So we lean on you, such as yourself, doctors such as yourself, to prescribe patients medications. We can give suggestions to use over-counter medications, but we don't prescribe medications. So what will be a optimum situation is where your chiropractor and your medical doctor or your primary care provider can work in concert together to determine what medications would be best for you as a patient, if need be. Medications such as Flexeril may help, which is a muscle relaxer, may help patients relax their muscles if they are in chronic pain. Medications such as Ultrium are medications that also my colleagues have prescribed to patients. Because of the opioid epidemic in this country, in particular in some states such as Alabama, a lot of doctors try to shy away from long prescriptions of Norco, or used to be called Loratab, because of its addictive pattern if given for long periods of time. So the beautiful thing about what I do is work with medical doctors, primary care providers, and we come up with a plan in concert with the patient to determine what type of medication to be on, and also to encourage the patient to, let's say, start with chiropractic care and try to ease their way off the pain medication if they're on pain medication. And that way they're kind of getting two things, I guess the best of both worlds, really. They're able to get a little medication to kind of help ease up their discomfort, but get some chiropractic care in order to help and improve their mobility.
Thank you so much for clarifying that for us, because I don't think I led the question as well as I could have, but absolutely, I agree. Working together with medical doctor and a chiropractor is really the best of both worlds, just like you said, because we've worked together, and I appreciate that you see things that I may not be able to see, and vice versa. And so being able to look at things from our different perspectives usually ends up in really helping the patient in a great way. And I definitely do agree that having your chiropractor work with your medical doctor is the best way to go. As you mentioned, there are some over-the-counter things in general categories that, of course, will address the back pain depending on the nature. So like you said, if the muscle pain is related to muscle spasms, then a muscle relaxer will be a great way to go. If it's related to inflammation, such as an arthritis, an anti-inflammatory might be the best way to go. So it's definitely a discussion with your doctor based off of your needs and the reason for your back pain. Now, I know that you also work with some topical things. Is there anything specific that is harmless? Nothing that might contraindicate with other things. And I'm talking about lidocaine topically, because we see a lot of these ads on TV for I think it's I don't want to name the brand, but some lidocaine for some big brands. And we see these athletes supporting sprays and things like that. So how do you feel about those over-the-counter products? Are they harmless enough for patients to try first, or what would you say about all that?
Well, I'm going to try my best to stay away from naming products as well. I do have some of my faves, though.
Got it.
I do have some favorite products that's over the counter.
Of course, yeah. If you need to, of course, if you do really like a specific product, you can say that, with this disclaimer that you are not being paid by them to say any of this.
Right. I'm not being paid or endorsing anybody, but there are topical creams that you can buy at your local pharmacy or Walmart that may be beneficial to you. Some of them have menthol in them, menthol in them, or 2% or 4% you can probably buy over the counter. Anything higher than that, your doctor may need to prescribe. But there are a lot of over the counter rubs, creams, roll-ons that may help. Also, a lot of people like to use heat pads at home, and let me tell you this, that heat pads do have a warning in the box when you buy it, but we do not read the warning. So the warning is, do not use a heat pad pads no longer than 15-20 minutes. Too much heat on the certain area feels wonderful, I know, but it also can create some stiffness because what the heat is doing is pulling blood to the area, but too much blood ends up causing swelling. And I have had patients over the years who have used so much heat to the point where they're stiff and can't move. So we don't want that to happen. So anytime you're in doubt whether you use ice or heat, always use ice first before you talk to your doctor if you can't get to them.
I love that. Thank you for sharing that, because I get that question a lot, ice versus heat. It's a hotly debated topic.
Mm-hmm.
And I have to agree with you. I always recommend, I said, ice doesn't feel as good, but it's usually the first thing to do acutely, meaning right after you have an injury.
Right, which in the first 3 days, yes.
Mm-hmm, exactly. So before we wrap up, I want to make sure we go over how patients can have access to a chiropractor, and that includes the referral process. So what I mean by that is, do they, one, need to get an x-ray or some kind of imaging before they come and see you? And do they need a referral, or can they just come and see you as a chiropractor? And how do they do that? Because you did mention that you want to go to somebody who's reputable and experienced. So a few questions to get through.
That's a very good question. It depends. If a person has health insurance, then depends on the health insurance plan. The plans usually determine if you need a referral from your primary care or not. Your plan may also determine how many visits you can have to your chiropractor per year, or if there is a monetary limit on how many visits you can have to the chiropractor. So check your insurance plans first if you have insurance. If you do not have health insurance, then it is up to your pleasure. And so you can go to any chiropractor within your area. You can Google search for a chiropractor or go to the internet to figure out who's a chiropractor that's near you. Or ask a friend. They may have a chiropractor that they like, and they may could refer you to one.
Excellent. Thank you so much, Dr. Burton. I really appreciate you taking your time to go over everything that we did today. I really wish you all the best in your career.
Oh, thank you very much. And I wish you the best as well. And I appreciate you having me on What's Up, Doc. I really enjoyed it.
Thank you. Thank you for joining us on another episode of What's Up, Doc. You can watch our other episodes on our YouTube page at youtube.com/Muslim Network TV and on our website at muslimnetwork.tv. I'm your host, Dr. Aalia Al-Barwani, and I'll see you next time on another episode of What's Up, Doc.